Sister Soswan, can you share the link on the chat?
Assalamu alaikum, everyone. I hope you all are doing well. So we are going to go ahead and give people about 3-4 minutes to join the meeting, but we are so excited to have you. And while we are waiting for everyone, it would be great to know where you all are streaming from. So go ahead and use that comment link to be able to show us and let us know where you are streaming from. So we have people coming in from Atlanta, Johns Creek, another one from Atlanta. Ooh, Miami, Florida. Welcome. That's awesome. All right, so we're gonna go ahead and get started. Assalamu alaikum, everyone. I hope you all are doing well. Welcome to phase 3 of Co-Victory 20. We are so excited to launch this. As you know, Co-Victory 20 has 3 phases, and I actually go ahead and share my screen to show you what those 3 phases look like. So we do have those 3 phases. Phase 1 is survey and data analysis, and this is basically where we had everyone indicate to us what are the most important needs and interests within the community so that we can further phase 2 and phase 3 to be specific towards your needs. Phase 2 is a community forum, which we had last week. MashaAllah, was a great success, and we are so happy that all of you joined us. And phase 3 is a virtual programming that is being kicked off today. So inshallah, we will be joined by Brother Murtaza Khwaja and Sister Isabel Otero to discuss the resources, policies, and aid available to you at the federal and local levels. So let's go ahead and get started. We will be first going into the federal level. Isabel Otero, it's so great to have you with us. And what are the federal and federal resources that are available to us at this time?
Hi, everybody. Thank you for having me. As Saswan said, I am Isabel Otero. I'm the Policy Associate for the Southern Poverty Law Center. And I am going to be talking to you all about all the federal policies that have been passed recently to help those of us who are weathering the crisis. Thankfully, my folks are all doing well and safe, and I hope the same for everybody else.
And I want to thank you, Isabel, for taking this time to, come and sit with us. We know it's a busy time for everyone. It's scary being out there, being locked at home with your families and not really knowing when this thing is going to end. I've been, holed up here in my apartment by myself. I want to social distance from my parents. They live in Atlanta as well, but they are older, so I want to make sure that I don't expose them, to anything that might be dangerous for them. So it's been tough for all of us, I imagine. Sausan, have you been doing well?
Alhamdulillah, this has definitely been a very interesting test for us, and I'm praying that everyone has the ability to get out of this victorious, and that's kind of why we actually called the initiative Co-Victory 20 to be victorious, come out of this victorious. So, alhamdulillah, it's been a struggle, and but I'm hoping for the best. Isabel, how are you been doing?
All is well. We're also my husband and I have been staying home as much as possible. He is an essential worker, so he does have to go into the office, but I've been, my coworkers these days are my 2 cats, and that's all that I get to interact with for most of the day, unless I'm on Zoom or FaceTime with coworkers. And but all is well. Social distancing can be really hard, so I'm glad we have an opportunity to sort of explain what's going on and just make sure that folks get a better understanding of everything that's happening to help them and provide resources for them. So thank you all for having me.
Absolutely. And we do want to thank all our partners. So part of this phase 3 is a webinar initiative. We're going to have several different webinars, but part of them are going to be geared towards really addressing what's been the lack of social services in what's exacerbated the country's ability to address this pandemic. We've seen everything from not having accessible healthcare to not having affordable housing to not being able to have paid time off or sick leave. So these are really important issues that we have a lot of really great groups, including the SPLC and the SPLC Action Fund, partner with us on creating this content and allowing us to engage with the community and having a conversation. So we're really glad to have you here, really glad to have Sausan here as our host. And I'm gonna cut off now and let you get straight into what's going on in the federal level.
All right, awesome, thank you. So the first thing I wanted to do was just talk about the 2 main pieces of legislation that have recently passed. So there's the CARES Act, which was the big $2 trillion package. It expanded the ability for everybody to get free testing for COVID-19, for the coronavirus. It does not change the Medicaid requirements, but it does provide more funding to health centers and other places where all of us would go get tested should we need to. And then there's the Family First Corona Response Act. And that's the economic relief package that is providing cash to Americans and to folks who are in need. It's allowing for the expansion of Medicaid programs at the state level. And unfortunately, there are some states that are more that allow different sorts of immigrants, depending on their status, to have access to Medicaid. Undocumented workers and families may not have access to some of the Medicaid expansions. And so there's some parts of the federal stimulus policies that apply to everyone and all immigrants, and then there are some that apply to most people. And so there's a little bit of tricky things here and there, and I'll try to explain those as we go along. And there'll be plenty of chances for people to ask questions. So if there are questions that are coming in, please feel free to let me know so that I make sure to stop and re-explain anything that might needed. So with that, just to, ask if there are questions already coming in about the two different policies, let me know.
So we do have a question, Isabel, and it is asking, is getting treatment, testing, or preventative care considered a public charge, even if services are provided by Medicaid?
That's a great question. So the public charge is the recent rule that came out that talks about whether or not an immigrant has received one or more public benefits and whether that will affect their ability to adjust their status later on. And so the answer for this particular treatment and care and testing for COVID-19, it does not qualify as a public charge. So people should not feel like getting treatment or testing for the COVID-19 virus is going to affect them later when they try to adjust their status.
Yeah, that's definitely very important information to know. And we do have another question asking, will ICE be doing immigration enforcement at hospitals? Which is, I know that this has been an issue that has been brought up multiple times in the news. So do you have an answer for that?
Definitely. So, ICE, it's unlikely that ICE would be going into hospitals or treatment centers or community health centers to do any enforcement. Under the federal law, under federal laws, there is no prohibition for ICE to conduct enforcement in what we would expect to be safe spaces. However, there is a longstanding policy to avoid and very much limit the enforcement at schools, at medical facilities, at places of worship, and public demonstrations. And so it isn't a law, but it's very unlikely that people would be experiencing any ICE enforcement or immigration enforcement while they're trying to get help for the coronavirus.
Wonderful. And would you happen to know if there are going to be other laws passed that are related to the coronavirus pandemic?
Yes. So they're right now, they're talking about it in the news a lot as phase 1, phase 2, phase 3. So phase 1 was an economic appropriation bill, right? And it provided more funding to those agencies and places that are helping us. Phase 2 was targeted relief. And so that's where we get expanded family paid leave, and we get some of the stimulus package information from the CARES Act. And then phase 3 is that broader economic stimulus specific to people, and it provides direct relief to individuals and families with the cash rebates and things like that. And we understand that right now Congress is in the process of doing phase 4, which would be a different set of packages and legislation that they will pass to continue to try to help the economy, especially small businesses and folks who are struggling during this time when they are being asked to shut their doors while we weather this crisis. And if there are no more questions, I can keep going, but please, keep them coming, everybody. If there are additional questions that you have and we don't have a chance to get to them, we'll make sure that you all get the information later on as well. So the next section that I wanted to cover was workers' rights. So right now, employers who have less than 500 employees, so that's not huge employers, but it does cover quite a number of different entities and employers. And these are the workers who will have immediate paid leave for 2 weeks if they need it, if they are being treated for the COVID-19 virus, or if they are caregiving for their family or their children who are infected with the virus. And so those large employers are immediately able to provide paid leave for their employees in that situation. This does apply to all immigrants. There are no restrictions because paid leave is coming from your employers and not the federal government directly. And so all workers, no matter how long they've been employed or how many hours they regularly work, would be eligible for getting 2 weeks of paid leave to be able to recover from COVID-19. And there are some exceptions. If there are healthcare workers on or first responders, we can cover those exceptions. But this kind of paid leave is going to be available between April 1st, which already passed, all the way through December 31st through the end of this year. And if someone is denied paid leave, if they're discriminated against, if they suffer retaliation, it's very important that you all have the information for the Department of Labor. Those are the folks that make sure that if you work, that you get paid for all of the hours that you work, no matter your immigration status. And for this particular issue, they are also the ones that will enforce employers providing and extending the paid leave that you all need to be able to get better. And so that information is there. We'll make sure that you all get that information as often as you all may need it. And so the other issue that is under workers' rights is extensions of family paid leave. And so there's the Family Medical Leave Act that is previous legislation that's passed to provide people with job protected leave if they need to take care of their families. These last two big pieces of legislation expand that temporarily to include caring for a child that, for example, has had school canceled for the rest of the year. And so at 2/3 the rate of your pay, you're able to get extended leave for 10 weeks to be able to take care of your children and provide them with whatever they might need from school and other homeschooling. I know a lot of parents are having to deal with that and work. And so it's been very, very difficult. And so this allows people to sort of focus on their family should they need to do that. And this, again, does apply to all immigrants, no matter their status, because this is, again, a benefit that you're getting through your employer and not directly from the federal government. And that's sort of the distinction. For those employees who are self-employed workers, so they own their own business or they're contractors, they are going to have an income tax credit next year that will help them gain back some of the money that they might have to be using during this time. And so their extended leave is slightly different. But it's important that folks know that this is available, that you all have leave available to you should you need it, especially now that so many of our schools in Georgia already have canceled school for the rest of the year, but in states across the country, they've done the same. So it's very important that folks have that information. The next thing that we can talk about is unemployment insurance. And so unemployment insurance benefits are given to people.
Sorry, Isabel, we got a question and I want to make sure we got to it before moving on. So we had a question on whether it applies to H-1B workers. And I think this is for the family medical leave.
Yes, so it should apply for anybody who is a worker in the U.S. and it's through your employer. So it shouldn't have, it should not depend on your status whether or not you're able to get this family medical leave that's been extended. And so you should reach out to your employer as best you can to get the information that you need for any forms or any coding that you might have to put on your timesheet. But it should be available to all workers. Thank you for that. I appreciate it. It's a lot of information. So I realize we're trying to give you all the highlights and the info that you need to make sure that you know where to go to get more information and resources from your employer. All right, so with that, we'll continue on to unemployment insurance. Unemployment insurance is currently available for a limited number of workers, right? You have to be actively looking for work. It only originally lasts for 26 weeks. This is what has been added to those benefits now for those who are out of work, specifically because of the coronavirus and during this time as we're weathering the crisis. And so unemployment benefits now have an additional 13 weeks added to the 26 original weeks. So now you have 39 weeks of unemployment insurance that you're able to get. If you've already exhausted those first 26 weeks, you now get these additional 13 weeks of unemployment insurance if you qualify. And so this is one of those benefits that comes directly from the federal government, and therefore you have to be work authorized according to the federal government to receive this. And so someone who may be undocumented and working is not able to get unemployment insurance benefits because they're coming directly from the government. For now, those who are eligible for this unemployment insurance are going to be able to get $600 weekly in addition to any of the unemployment that they were originally getting. And that'll last through July 31st. And so that's specific to this crisis. And it helps people who are struggling and their families may be struggling because they cannot work during this time. And employers with fewer than 500 workers will be able to receive loans. So if you're an employer yourself and you are trying to provide people with their salaries or unemployment, you're going to be able to get a loan that will be forgiven to be able to pay for payroll costs and other things that you may need to weather the crisis as well. And so this eligibility is also extended to people who wouldn't otherwise be able to get unemployment insurance. So self-employed people, part-time workers, those who have been specifically laid off or have had to go to do caregiving duties because of the COVID-19 virus, you will be able to get this type of benefit now. And then
we did have another question there, Isabel, and I did want to mention before, I think one of CARE's biggest concerns with this piece of legislation is the fact that this doesn't extend to undocumented immigrants. These are people who are a large percentage of essential workers and who are still in the workforce. And what we know is when one person in our community is exposed to this and is facing this type of exposure, we're really exposing the entire community. So if we're not looking out for every single person of our community, regardless of immigration status, then we're endangering the entire community as a whole. So I did want to mention that. We also had a question on whether or not this unemployment insurance is on top of state unemployment benefits or whether this replaces state unemployment.
Yes, so this unemployment, first of all, just to say that it's absolutely the case that undocumented workers are working in the U.S., they are here, and they are contributing to their families and to all of our communities. And so it's very frustrating for a lot of advocates who've been trying to ensure that there were protections and added benefits for those workers. But we're still trying. We've got folks, I know CARE does and SPLC does in DC, hoping that for whatever next piece of legislation that we're able to provide some care for some of these workers, because it is absolutely the case that there should not be anyone left out of these, that there's no one left out of the crisis. There shouldn't be anybody left out of any resources that are available. But the question about whether or not these unemployment benefits are on top of whatever the state unemployment benefits that you're already getting, that is the case, right? This is in addition to and not in replacing anything that you're already getting. So if you have unemployment benefits from the federal or state governments, you're going to get that. And in addition, you're going to get another $600 a week during the crisis until July 31st of this year. And do we have any other questions? I know all of us are watching.
We do. So we have one on unemployment. We have a couple questions that we're actually going to get to, I'm sure, later on. But the one question about unemployment is, what happens in a scenario if an employee has been laid off from their company due to the current pandemic?
So if someone's been laid off specific because of this pandemic, they are going to be eligible to receive unemployment insurance benefits for this additional time. And during the first 4 months of this crisis, they'll get the additional benefit of the $600 a week. And so, yeah, very specifically, if you're laid off because of or you're being asked to be furloughed or being asked not to work during this time because your employer is not an essential worker or doesn't need you to be at work, please file for unemployment insurance if you're eligible, and please make sure that you're staying on top of any other new information that comes through should any of this be extended.
Great. We're actually getting quite a few questions on this, and I think that sort of shows the level of engagement that you as a community have, and so we're happy to answer these questions for you. Another question is whether the unemployment benefits apply to H-1B, people who hold H-1B visas. And there's another follow-up question after that, but not related to H-1B. So I'll let you answer that one and then we'll come to the second.
That's actually a tricky question, and I'm not sure that I know the exact answer for people who have H-1B visas, just because those are tied to the employer. So I'm happy to get more information on that and either post it on social or something like that, unless you happen to know the answer. I don't want to give people the wrong information.
Right. I don't have it in front of me right now. I think we're going to come back to that and try to make sure. We had another question about whether Uber drivers can apply for this. And so the question is asking if they can apply for this at the state level. And again, I want to differentiate, and I'm sure you're going to do the same, that there's state benefits, unemployment benefits you can receive, and this is sort of federal benefits that you receive.
That's right. And so the expanded benefits for unemployment at the federal level are trying to target people who have jobs that are not, the same as someone who just goes into a larger employer, right? Someone who's self-employed, like an Uber driver, my understanding is that they would be able to get this federal aid and unemployment insurance for the moment. But that is one of those questions that starts to get a little bit trickier. And so I'm happy to follow up on that as well. Yeah,
and I mean, from my understanding, Uber drivers it's the same thing with part-time workers. They'll be able to get this type of aid as well, the $1,200 check, or the unemployment insurance, sorry. We have a second question on whether an employer has to apply for their insurance for this person. And this might go a little into, I know this is going to go into the state benefits as well, because there's Georgia law on this as well, but at least is there a federal requirement for the employer to have to apply for this insurance for this employee?
I believe that that's the case, that some of the unemployment insurance benefits are things that the employer will do, and whether or not they receive one of the loans that will be forgiven to be able to pay for any payroll or unemployment during this time. And as we get questions that are more into the weeds, I do want to make sure that people get the information. So I'm happy to get as much info as possible and share it after this as well.
Yeah, and we'll make sure to share FAQs with all the questions that are being asked, as well as all the information we prepared that we'll share with the community. Please keep on sending these questions. We actually just got another one. Okay, so this is in regards to the SBA loans. We're having a few questions on that, and I know you're going to get to those. So I'm going to leave that one for the SBA section. If it doesn't get answered, I've marked it here. So we'll definitely come back to that.
Great.
Yeah, and we're going to have a follow-up session as well in the coming days. And we're going to have these resources available for you. So thank you for asking these questions. These are important questions. We're doing our best to answer them. One thing I do want to reiterate is that I'm an attorney. This is not legal advice that we're giving to anyone, though. We are giving general knowledge and general information. We're not giving you legal advice on your particular case. If you do have questions, please feel free to call CARE Georgia during the week, or if you have our number, call us on the weekends as well. We'll be happy to either answer your questions if we know, or more likely refer you to someone who may be able to answer your questions. So I do want to reiterate, we are giving general information. We're giving you accurate information, but this is not legal advice to your particular situation.
That is a very helpful disclaimer. I am not an attorney, but I'm glad that Murtaza is on with us. But yes, that is very helpful. So we're just going to move on a little bit to the recovery rebates. But like we've said, please continue to ask the questions that you have, and we'll continue to either answer them live now or provide you with the FAQs later on. So for the recovery rebates, the biggest issue with this is that unless you have a Social Security number, and that is the number that you use to file your taxes, you will not be eligible to receive the recovery rebates. And so that's one of the biggest issues that leaves out a significant number of our workers, like we've said already. And it's because it is a benefit coming directly from the federal government and not through an employer, but it nonetheless affects a significant portion of the workforce, and we continue to advocate at the federal level for some of these changes. But for those who are eligible, this provision allows those with a Social Security retirement already or with disability payments to get this additional rebate. And anyone who's filed their taxes recently within the last couple of years will already be automatically given the rebates based on their last tax filings. And so veterans are eligible, people who are on unemployment are eligible. The only folks who are sort of left out of this recovery rebate are people who do not have Social Security numbers. And that means that if you have a Social Security number, but your spouse does not, and you filed jointly, you will not be receiving the rebate, right? So, or if your child is a US citizen, but you do not have a Social Security number yourself, you will not receive the rebate for that child. And so it becomes very restricted so far as who is eligible for this information or these rebates. And that is, I know, very frustrating, but bear with us. We're doing the best we can to advocate to make sure that some of these things are changed. For those who are eligible, if you're an individual who makes less than $75,000 a year, you're going to be receiving $1,200 directly from the IRS to either via check or via direct deposit. However you received your last refund from the federal government is how you'll receive this check. If you are a couple and you've made less than $150,000 together and you filed jointly and you both have Social Security numbers, you will receive $2,400, so $2,400. There are then less amounts of money that are given to people depending on their income. If you make up to $99,000 a year by yourself or short of $200,000 as a couple, you'll receive slightly less than this. And we can provide, there's been a couple of places where you can sort of input your information and see in a little calculator like what you may be able to get. And the IRS website is being updated a lot with the information. So please make sure to check those sort of places to get additional, more specific information to you. If you have a dependent child age 16 years or under, that will increase the amount that you receive by an additional $500. Parents who have Social Security numbers will qualify for that extra benefit. And you may also note that except for older adults who rely on Social Security for their income, you have to have filed your 2018 tax returns or your 2019 tax returns. The 2019 tax deadline has been extended into the summer. If you're a person who hasn't been able to file taxes the last 3 years or is in the middle of an issue with the IRS for some other reason, you will still have to provide them with some information, some essential information in order for them to be able to send you the rebate. So while there is no form or extra information that you have to send if you've already done your taxes for last year or the year before, 2018, but if you are a person who has had an issue or hasn't been able to file those taxes, you will have an additional simple form to send in. And that information is being updated on the IRS website. And so it doesn't mean that you'll owe anything specifically to the IRS. This is just for the rebate purposes. And so if you're a person who hasn't filed, please make sure to check the IRS website, make sure that you're able to send in whatever essential information they might need for you to be able to get the rebate. And the other important information about this is that if you're an adult, but someone else, like a parent, still claims you as a dependent, you will not be able to receive the rebate. And so it has to be the taxpayer, whether they're a parent or a child. If you're an adult and you're claimed as a dependent elsewhere, you won't be eligible for the rebate. And then there is, like I said, no application process, and the payments are going to be dispersed within 3 weeks of the signing of the bill. And so as soon as next week or the week following, we should start to see those rebates come through for those people who have already filed their taxes or who are filed their 2018 or 2019 taxes. If you haven't filed those 2 years of taxes, please make sure to check the IRS website to make sure that you're able to send in the information they need to get the rebate. And receiving this will not count again as becoming a public charge like we talked about at the beginning. So if you're an immigrant and you have a social security number, many immigrants do for whatever status you have, you file your taxes, you're not going to be penalized later on for receiving this rebate. This will not count as you becoming a public charge to the US or to your state. So that's important to know. I'm sure we're getting questions about this.
Yeah, we've got a couple of questions.
Yes.
I want to leave the screen up because this is actually perfect for the questions that we're getting. So the first question is, if one has a social security number, an ITIN number, which is, for someone who doesn't have a social security number, and they have a social security number and the spouse has an ITIN number, they want to know how much they're eligible to receive. And then we have a second follow-up question, which I'll come back to after.
So unfortunately, both people who are the taxpayers, if they're filing jointly, if they filed jointly, will need to have a social security number. So my understanding is that an ITIN number, a tax number, is not enough to get you this rebate. You have to have a social security number.
And then the second question is, if someone is the head of a household with a college student dependent who is over 16 years of age. So I don't think the 16 years of age is necessarily determinative here, but so they are a head of a household with college student.
So my understanding is that the college student will not receive a rebate and the parent will receive the regular $1,200 or $2,400 rebate. But because the child is over the age of 16, my understanding is that they will not receive the additional $500 per child. And so, that's something I'm happy to clarify as well in an FAQ later on. But that was my understanding from our reading of the bill.
And then the second question is, if eligible parents that have two adults as dependents will get 1,200 times 4, which is not the case.
Correct.
I clarification there.
Yeah. So the clarification is that if you have dependents who are adults, then you will not get an additional rebate per dependent. And those dependents will not get their own rebates either. So if you are a married couple, you filed jointly and you have 2 kids in college and you claim them as dependents, you will still only get $2,400 in your rebates. And those children, since they are considered dependents, they will not receive their own $1,200 rebates. Hopefully that it's a little bit confusing, and I totally get that. But hopefully,
no, I think you explained it very clearly, and I think this graph does a good job of that too. So just because we are getting a lot of questions on this, do you mind walking us through this graph one more time? And individuals receive it, couples receive this, and just so people have some clarity.
Absolutely. So it's important to know that the only people who are getting rebates are people who have social security numbers. If you're an individual and you filed your taxes as an individual, you'll receive $1,200 if you are someone who is making $75,000 a year or less in your gross income. If you're a couple and you make $150,000 or less jointly in your gross income, you will receive $2,400 in the rebates. If you are a parent of a child that is 16 years old or younger than 16, you will receive an additional $500 per child in that rebate. And so these are rebates that if you've already filed your taxes for 2018 and 2019, you will be receiving them directly. If you have not filed those taxes yet for the last 2 years, the tax deadline for 2019 has been extended, and you may have to give additional information to the IRS specifically to receive these rebates if you have not filed the taxes. So there's an extra step if you haven't filed yet, but there is no extra step for those who have already filed their 2018 or 2019 taxes.
So there are 2 more questions, and then I think we can move forward, but I think we've done a great job in explaining this as well. The first one is, so if you have 2 college students as dependents, then I think you are still able to get something. So, or I might be wrong on that, but Isabel could.
So, yeah, so my understanding is that the dependents have to be 16 years or younger.
Okay, so that's so once they're in college, then
That's right.
they're eligible for it.
Yeah.
So that's good to know. And we've had a couple questions about that. And then the second question is, someone claims their 81-year-old mother on their taxes. She receives Social Security. So they're wondering where the rebate goes.
So the rebate will go to the person who has received the rebate will go to the person who is claiming the dependent and not the dependent. So their 81-year-old mother will continue to receive her Social Security, check and any other disability insurance, whatever else she's eligible to get. But she will not herself, the 81-year-old who's a dependent for someone else, will not receive a rebate herself.
And then from my understanding, then the person who's claiming them as a dependent, would they receive anything additionally? Yeah.
No, my understanding is that if they're an adult, if they're 16 years or younger, they'll receive an additional money. But if they are 16 years old or older, like the elderly parent, they will not receive an additional rebate for that person.
That's important information. Thanks for sharing that, Isabel.
Absolutely.
Isabel, we do have two pre-submitted
Yes.
questions if you can.
Great.
So we do have a question about if I did my taxes but I am undocumented and my child is a U.S. citizen, would I still receive the $500 per child?
So unfortunately, that's another issue. If the benefit requires that you're a taxpayer, a parent, who it has a Social Security number. If your children do not have Social Security numbers, that is okay. You will still receive their rebate, but you yourself as the taxpayer have to have a Social Security number. And so that's an important distinction. Thank you for the question.
Great. And then one more question is, will I receive a rebate every month until the pandemic is over?
So no, this is just a one-time rebate. In the different other phases that the Congress is considering, there may be some other additional rebates that are given out to Americans. We do not have that information yet, and there's nothing that's been decided. So this is a one-time recovery rebate, hoping that people are able to use it to weather the storm for the next few weeks as states do whatever they need to do to flatten the curve.
And with these questions, I think the biggest thing for us to also emphasize is from a policy standpoint, we recognize this is not nearly enough. The one-time check is not enough to even pay rent for a lot of these families. There are people, again, who are being ignored, taxpayers with individual tax identification numbers who are being ignored. They pay taxes every year, but they're not getting any of the stimulus money. Again, it's a one-time check. In other countries, what we've seen them do is already pass several pieces of legislation or a large piece of legislation that authorize it to happen for a refund check to be issued for 6 months, 4 months. And really, I think that's the bare minimum at this point. We're living in a pandemic time. And again, we're only as healthy as our most vulnerable and our most marginalized. And if we're continuing to ignore those people and these types of legislation, we're endangering our communities and making this pandemic last even longer.
That's exactly right. Hopefully, as we continue to advocate for more for people and for more people to be included in these recovery relief efforts, we'll get a little bit of a win here and there for everyone. Because that's absolutely right. There are plenty of taxpayers who are being left out of this equation.
And one last thing, because we got this question one more time about H-1B workers. H-1B workers, unfortunately, are going to be ineligible. We did a little bit. We looked into it and we made sure, that they are going to be ineligible for this. So it's unfortunate, and again, something that is sticking point, something that we need to lobby for and call our representatives for. But H-1B people will not be eligible for this stimulus.
That's right. So please keep the questions coming. We'll make sure to get to as many as we can, either today or in an FAQ later on. So moving on a little bit, for federally held mortgages. And so homeowners who have a federally held or federally backed mortgage, like an FHA loan, like a VA loan, they will have the right to a forbearance on their payments for 6 months. So they won't have to pay that mortgage for 6 months. And there's a possible extension after that for an additional 6 months. And that will be through your mortgage company directly. And I just advise that people have a lot of patience when they call these folks, because they're getting a lot of calls, and some of my family members who have had to call or friends have been on the line for a while. So just have a little bit of patience when you do call if you're in need of support with your mortgage. And this will be a forbearance without any penalties or extra interest, right? So you'll just stop your payments for 6 months and start back up without any additional money to have to pay. So that's really important. And the thing about these is that these have to be federally backed mortgages. And so it's not always clear based on the mortgage company whether or not that's a federally backed mortgage. And so that's important to call and ask your mortgage lender directly. And for those who live in public or assisted housing, who have a landlord who has a federally backed mortgage, those are also people who are protected from eviction for 4 months. And so if you are a person who is in danger of being evicted, some states have already said that you will not be able to be evicted during this pandemic at all. But if that is not the case, and your landlord has a federally backed mortgage, you are protected for 4 months. And so that's very important to know, that it's not just people who own a house, it's also people who are renting or in public housing or assisted living housing. I don't know if there are any questions about that. That's one of those smaller issues, but as questions come up, I'm happy to talk about them. There's a different set of loans that we can talk about in the meantime. And that's for student loans. And so for student loans, if you have a federal student loan, so that's something backed by the US Department of Education, your payments and your interest is automatically suspended until September of 2020, September 30th of 2020, the end of September this year. And you can call your lender directly for that information. If you have a student loan, the moment you log onto their website, they will have information on there about what they're already doing, most likely. But for those who have a loan directly that is held by the Department of Education, by the federal government, those payments and that interest will be automatically suspended. So you don't have to do an extra step to be able to get that benefit. And hopefully, if we have questions, let me know.
Yeah, I think Sasson.
Yeah, so this is actually a question that comes up in my own personal circle, and people have been discussing whether or not there will be loan forgiveness. Is that part of the package?
So my understanding is that for this moment, there's not loan forgiveness. There's just these, suspension of payment and interest for the moment. If you do not have a federally backed loan and you still need assistance, you should call your lender directly to get some of that assistance. But for the moment, there's not a loan forgiveness program that I know of and that I understand. Please, someone correct me if I'm wrong, but there are a suspension of payments and interest for the moment. And so, but that is advocacy that is happening at the federal level right now. There are a lot of folks calling for student loans. That is one of the biggest burdens, especially for younger people or parents of young people who are in college or just ended their college, time. And that's something that is quite a burden on families, especially if you're having to stop working or something because of the virus.
Now, I will say that we have a couple more questions, and one related to student loans. But from a policy perspective, CARE Georgia supports forgiving student loans on a total basis. We are in a crisis, as Isabel indicated. Other groups are working on this as well. We've burdened some of the most successful people, or people who could be very successful in our country, with this huge amount of economic debt from a time that they were very young. This burden has not only held them back and constrained what they're able to do, but also held the country back from what we can do. And what potential we can reach. A lot of the reasons why people don't have savings and don't have capital to properly address this pandemic is because we've been paying these outrageous amounts in federally held student loans. So one way to sort of stimulate the economy and make sure that we do have those type of resources and that safety net for people, or that they're able to build that safety net for themselves, is to forgive student loans on a total basis. We do have a couple other questions. One of them is, are there programs or grants to forgive student loans? And I think Isabel just answered that as part of this legislation, it's not, but the House Democrats in Congress did propose their own bill, did put forth their own bill where they did have $10,000 in student loans being forgiven. That did not move beyond the House, but that is a conversation people are having. So I would encourage all our viewers to call their representatives and lobby on behalf of on this issue. This is something that we can push for, and this conversation is being had. People are willing to listen right now, and it is a crisis. So this is the time to really, and the current pandemic crisis we are in is partly because of this ongoing student loan crisis. So it's important to lobby on that. The other question we have is back on unemployment insurance. So we're going to move back just for a second. Isabel, are folks who are authorized to work but are awaiting a hearing on their asylum petition eligible for unemployment insurance?
If you are work authorized, you should be eligible for unemployment insurance, and you should be able to get these additional weeks and this additional money during these first 4 months of the crisis. And so if you have a work authorization card and you are work authorized, you're one of the folks who are waiting for adjustment, but you can continue, you can work right now. So asylees, refugees who are here are automatically and immediately eligible for work. You just have to make sure you have the right combination of documents to show an employer. And if you don't have, or if you're getting any pushback, we can provide you with some information about where to go to get some additional help with that. Care Georgia is one of the best, or Care National and Care Georgia, you can call to get any assistance. But an asylee and a refugee are immediately authorized to work when they arrive because of their status, right? And so they are work authorized people who, should you lose your job or be furloughed or laid off because of the crisis, you should be eligible for unemployment insurance.
Thank you for that information, Isabel. And again, we're providing general advice and general knowledge about these pieces of legislation, these benefits, these policies. Again, this is not legal advice to your particular case. I just want to make that disclaimer. I'm going to say it a couple more times, the attorney and me, just to make sure you all know that you are free to call Care Georgia on this and ask for us, and we can refer you if we don't know the answer. But for right now, we're providing general advice. We appreciate these questions and we'll do our best to answer them. It does not constitute legal advice.
That's right. Thank you so much. And I'll leave it there for all of the federal stuff. We definitely want to get to some of the local information that we have to share. So I will stop sharing my screen and let the next presentation come up.
All right, so we are about midpoint in our conversation. So I do want to go ahead and welcome any of our new viewers. And please go ahead and engage in that comment section and let us know where you're streaming from. We are interested in knowing, and be sure to ask those questions. I really appreciate the amount of engagement within the live comment section. So Mortaza, it would be great for you to go ahead and discuss any of the local initiatives that are in place during this time.
Yes, I'm happy to do that. I'm going to share my screen in a second. Just need to figure out how to do that. So actually, it's technical difficulties, but let me make sure that I can do that. One moment, please. And Sausan, can you, I'm just going to give this opportunity to you to plug. I know we have a webinar coming up tomorrow. If you can talk a little bit about that and give people a little bit more information about COVID-19 and where it arose.
Yes, that is a wonderful opportunity. So this is phase 3 of the COVID-19 20 initiative. And so it's preempted by phase 1 and phase 2. Phase 1 was a survey to kind of gauge what the interests and needs are of the community. And then the second phase was the community forum. So this is a final phase, but it's also the longest phase because we will be continuing to have different webinars every weekend, Saturday and Sunday at 8:30 p.m. inshallah. So tomorrow we are having a webinar called Mind Your Mental, and basically you'll be talking about the psychological resilience during COVID-19. We have Zahra Murtaza, and we also have Flavia Almonte. And so they'll be talking about kind of the mental coping mechanisms that we can put in place within the family and then also individually so that we can better cope with what's going on around the world. So Murtaza, it would be great for you to kick us off on the local initiatives.
Absolutely. So I'm going to share my screen. I think now this should work. Can everyone see that? I want to make sure that they're able to see.
Yeah.
Okay, great. Thank you again, everyone, for joining us. Thank you, Isabel, for that amazing presentation. I know the SPLC is doing some amazing work, so I actually want to give this opportunity for you to do a plug on what the SPLC Action Fund has been working on. If the SPLC has been doing any other work, this is your opportunity to talk about anything that you guys have going on.
Thank you so much. I appreciate that. So the SPLC Action Fund is relatively new. That's our new C4. We now have folks working in 5 different states doing policy work. That's Georgia, Alabama, Florida, Mississippi, and Louisiana. And we have one person doing immigration-related federal policy work as well, which is where I've been able to get a lot of my information and have a sounding board about what's happening in Congress. And so we definitely are very interested in hearing from folks who are currently detained in any of the Georgia detention centers and need assistance. We have the Southeast Immigrant Freedom Initiative program where we're trying to support people and provide resources for families to get their family members out of detention. We're also very much watching what the state of Georgia is doing specifically about the presidential preference primaries and making sure that everyone who is eligible to vote and wants to vote has the ability to do so without any barriers. And so please, keep us in mind, follow us on Facebook and Twitter, and make sure that you let us know when there's something happening. Our job is to make sure to fight for the most vulnerable people in our society and alongside with you. And we just want to make sure that people have the resources they need and make sure that everyone has their civil rights protected during a time of crisis, right? We want to make sure that just because there is a crisis, people are not having their civil rights trampled and are able to get what they need during this time. So thank you all so much. And please make sure to follow us to get any additional information or give us a call. Thank you.
Thanks for that, Isabel. Yeah, the SPLC Action Fund and SPLC do some really amazing work. We're very proud to have them as a partner and very thankful to have Isabel here to share her expertise. Please do follow them on Facebook, follow them on social media, and do follow the work that they're doing because they're really on the forefront of the civil rights fight, not just here in Georgia, but in the entire Southeast and the country, really. So that being said, I want to talk specifically about what the coronavirus, the COVID-19 pandemic response has happened in Georgia. So where we are nationally with COVID-19, we have 277,000 cases as of today. We've had over 6,500 deaths here in the United States. So those are the national numbers. In Georgia, we have about over 6,000 cases and over 200 deaths. That's 6,000 cases. That's over a 300% increase from last week. And last week was a 400% increase from the week before. What we've done so far is we've had this executive order that was issued on the 2nd of April, which went in effect yesterday. But we really just have not done enough. I want to be clear about that, and I want to call out Georgia leadership for not doing enough earlier. Because what we've done is we've seen an increase the past week of 300% of coronavirus cases, and the week before that of over 450%. We needed a swift response that was backed by the medical experts and that was backed by the CDC. What we saw was a failure of leadership, and that's led to this increase. It's hopefully not too little, but it's far too late to have made this shelter-in-place order. So that being said, as of Friday, the entire state of Georgia is under a shelter-in-place order, which means that all residents and visitors of Georgia have to practice social distancing. That means that they have to stay with 6 feet away from one another. Most businesses are closed unless they're critical infrastructure, or unless they're critical or essential. If they are critical and essential, then they can function. But if they're not, then they have to run at sort of a minimum level. No business or establishment shall allow more than 10 people to be gathered, especially if that gathering requires them to sit within 6 feet of one another. This doesn't apply to people if you live in a house, a cohabitation of a house. This is not a priority of your private life, but you cannot have visitors visit you unless they're there for life, for end of life care, for medical care, or to resupply the home. This is a very restrictive order, and it's something we needed to see earlier to be effective, to practice this social distancing, and we're hoping that it'll be effective in the next few weeks. The Georgia Public Health Hotline, this is the number for it. These are the people who are really leading the fight against COVID-19 here in Georgia. So this is the number to call if you do believe if you're showing symptoms of COVID-19. Right now, they don't want you to go to the hospital, don't want you to go to the doctor first. They want you to call the health hotline, and they want to talk about various things that you can take at home, various steps you can take at home, and they'll be able to tell you where you can go to best get care. It's not a situation right now where they want you to go see your medical provider immediately, because you may end up going to a clinic or maybe to a doctor or to a hospital that just doesn't have the resources to properly diagnose you or to properly treat you. And that's one of the things we've seen in this pandemic is our healthcare system has time and time again been proven to be broken. We don't have the resources to properly address the number of cases we've had. There've been ventilators there've been a shortage of ventilators, a shortage of PPE, which is protective gear throughout the country. That's not good enough from a country that claims to be industrialized, first world developed country. We've had very ill-developed and underdeveloped healthcare system, and it doesn't need to be that. We need to make sure that we put more resources in our healthcare system so that happens. Unfortunately, that's not where we are right now. In terms of unemployment, so Isabel talked about this earlier in the form of federal unemployment. The Georgia Department of Labor is also providing unemployment benefits for people who've been affected by COVID-19. It's already doubled the amount of people who have applied for unemployment. So because of this huge surplus and because of this huge increase, the Georgia Department of Labor has temporarily suspended the requirements for having to go in person to apply for unemployment benefits. You're able to do this online. There's also partial claims that you can do if you've made less hours, if you've had less hours or less pay over the last few years, or over the last few weeks, then your employer is required to make this partial claim on your behalf. If they don't do that, then they'll be required to reimburse the Georgia Department of Labor for that amount. The extension of unemployment benefits, it's gone from 13 weeks to 26 weeks. So now these state benefits, you'll be able to receive for 26 weeks. And part-time workers, which means if you're still having hours, if you're still getting hours at work, as long as you're making under $300, you'll still be able to apply for unemployment. So part-time workers are people who still have some level of work that they're able to do. They can still get unemployment benefits as long as they're making under $300. I believe we have a few questions coming up. On the chat, I'm seeing a few questions come up.
There's a question about small business loans. And so what, are you going to be covering information about a small business loan later on in the presentation?
I will, but this is a good enough segue. I've seen this question come up a few times to talk about the SBA loans. So the SBA loans, it's something that the Georgia Department of Labor has encouraged people to apply for. These are federal loans. There are a couple different options for them. So the first one is a loan that is for people for businesses, small businesses who have less than 500 employees. This can be nonprofits, this can be corporations, this can be your mom and pop restaurants. If you apply for a loan, you can apply for a loan with a 1% interest rate. For 6 months, payment on that loan will be deferred, but your interest will still accrue for that 6-month period. If you keep if you spend 75% of that loan to retain your workforce, you will be allowed that loan will potentially be made into a grant, and you won't have to pay back the actual loan, but you will still have to pay out the interest that is accrued. Now, these things are changing every day. I've been following the website, and their guidelines are literally changing every day because it's such a new piece of legislation. So this could change. This could change later on. But as of right now, the way it works is you apply for a loan. If you spend 75% of that loan on retaining your payroll, then you will be able to get that grant or that loan turned into a grant. You will still have to pay any interest that accrued on that loan, but you'll still be ending up paying less money than which you received. So that's the SBA loans that we've seen a lot of questions on, and it's for small businesses. You can also use the loan amount other than the 75%. You can use this for utilities. You can use it for mortgage payments on your property. There's a couple of other things that you can spend this money on as well, but you need to make sure that you spend at least 75% of that on retaining your payroll if you want it to actually become a grant later on. As a loan, it's at a 1% interest rate, and that does start accruing immediately. Although you won't have to pay, payments are deferred for the first 6 months. For food service workers, I want to get back to unemployment specifically because of what we've seen happen to the restaurant business. The Giving Kitchen is doing some really great work. There's a link to them that you guys can follow. So food service workers may be eligible for financial assistance through the Giving Kitchen due to any type of unexpected illness, injury, death, or of immediate family member or disaster. COVID-19 is covered under this. The Giving Kitchen can give financial assistance for a variety of things, not just for any type of payroll compensation, but also for utilities or help with rent. So that's an important thing. I think we have another chat. We have another question.
Yeah, so there's a question about whether or not the 10K loan will have to be repaid.
So again, it depends on what you use that SBA loan for. Now, if you don't use that to retain your payroll, then you will have to repay that initial loan as well. So this is a loan. The principal amount of the loan will have to be returned. Everything, all things even, if you don't apply for it to be turned into a grant, you will have to pay back that principal 10,000 amount. That's not something that they'll forgive unless you apply for the principal amount to be turned into a grant, which may happen. The condition for that is that you use 75% of that to retain your workforce, and that you actually do retain your workforce.
So we have another question, and the question is, what if someone has multiple businesses registered in their name? Will they get 10K grants for each business?
Yeah, I mean, it's the business is the entity. It's not for the person, it's for the business entity. The business, whoever the tax entity is, it will apply to that tax entity. Are there any other questions on this? No.
So the final, I think there's another question asking if you have a clinic, can I get PPE delivered?
So this is really dependent upon where you are and what type of healthcare provider you are. In Georgia has not seen the same type of shortage that we've seen sort of on a national level, especially in states like New York. However, there is a shortage in some areas in Georgia. We've seen healthcare systems send out letters to their healthcare providers that limits their use of PPE. We've had them overturn that policy by calling the hospital systems, but this is something that we've seen. So if there are, if you are facing some type of restriction of your PPE, please call Care Georgia. We might be able to put you in touch with someone who can help. But in terms of resources for how to get that, that's not something that we have for you right now. So if that's it for the questions, then that's that was the unemployment part. So healthcare access and resources, like I've said before, Georgia's healthcare system has historically been very low. We've been ranked 49th in healthcare access in the country, particularly in rural areas. Part of what we've seen is there is this horrible circumstances that are going on in Albany right now. Albany has the fourth highest rate per capita of COVID-19 diagnosis of COVID-19. And it's largely in part because of this lack of healthcare access, and also because the shelter-in-place order was not put in earlier. So Georgia's particularly at risk here. Lower income families are particularly at risk here. Georgia Department of Health has made this COVID-19 hotline that you can call. There's also this website that sort of links you to the Department of Health. There's some useful information there, but the hotline number is really the one to call if you have any particular questions on how to get PPE on your particular medical case. That's the website to go to. That's the hotline number to call. But Georgia does have historically poor healthcare access record, and particularly amongst lower incomes and particularly against people of color. For food access and resources, there's a few different things. Now, there's a school closure and meal service plans that's very county specific. I've listed all the counties where school systems have made some effort to share, to provide meals for their students. Now, this may not last forever. This may not be completely up to date anymore. These are just counties that have done it over the last couple of weeks. How long they're able to do that is going to be county specific. How they do that is going to be county specific. Some sent out lunches to their schools. Some sent out lunches on school buses at particular spots. So it really depends between county, between school system. So really look at your county website, your school system website. Go to those websites. They'll be able to provide you more information. But these are all the counties that have provided some level of meal service over the last couple of weeks. The Atlanta Community Food Bank has also amped up their services. I've left their link there as well. You can click on that link. You can reach out to that link. There's a lot of different areas in Georgia where they're providing food for people who don't have access to food. It's not nearly enough, but there are resources available. I would urge you, if you are hungry, to reach out to that resource, to follow that link. Housing, rent, and utility support. So Georgia Power has suspended utility shutoffs for 30 days. This is going to be a topic we talk about a lot more in the future, about affordable housing, about shutoff of utility and water, and how it's really not necessary. But for the next 30 days, Georgia Power has suspended all utility shutoffs. Atlanta Gaslight has offered some resources. Comcast is offering free internet to low-income households, and it's enabling free Xfinity Wi-Fi hotspot across the country, and that should be enabled. You can access that through your mobile phone or any other Wi-Fi accessible device. Comcast is offering 2 months free internet. Families without internet access can access Comcast Essentials free for up to 60 days. Additionally, they're increasing their speed of their current customers. So that's something that they're doing because they understand that people are at home, they're doing their businesses, people are at school. So these are just some things that these service providers are providing. New customers will receive a free self-install kit that will include the modem for a Wi-Fi router. There's no long-term contract or credit check, and no shipping fee associated with this from Comcast. AT&T is not terminating any wireless, home phone, or broadband service, and it's waiving all late payment fees. And while we appreciate these policies right now, I think, again, it's important to note, and it's an important discussion we're going to have later. We're going to have a whole webisode dedicated to this, that these predatory and usually discriminatory policies are really unnecessary in the first place. We don't need to be shutting off the utilities of water or electricity for anyone. If they cannot pay it, that doesn't mean that they don't have the right to live. People cannot live without water. People cannot live without getting benefits that they have to have internet connection to receive. So if people can't afford it, there are better solutions than just shutting them off and evicting them. On the eviction front, the city of Atlanta has put a 60-day moratorium from March 17th on all evictions, but that's only in the city of Atlanta. That's something we need to be seen extended throughout the state. That's not something we've seen so far. For college students, U-Haul is offering free storage to college students who've been displaced from COVID-19. So that's a resource for people as well, especially the college students. We know we have a lot from Georgia Tech, Georgia State, UGA, Emory, Morehouse, Spelman. We have a lot of great colleges, and they were really shut down very quickly. So U-Haul is offering this service.
So just to reiterate the renter issue, so most mortgages for any building, 70% of all mortgages fall under mortgages that are federally backed. And so it's important that folks know that if you are living somewhere where you have a landlord who has a federally backed mortgage, you are protected from eviction for 4 months. And so it's may not be the easiest thing to find that information, but that does apply to almost all renters right now. And so it's important to know that you do have some protection from the federal government as well.
And that's important information to share. Thank you, Isabel, for sharing that. That's very important for you to know. So please do check with your mortgage holder or your landlord. Another thing I do want to mention is there's an app on your phone you can download that's been developed by the CDC, Apple, the White House, and FEMA. It's called COVID-19 Screening Tool. It also gives live updates on the COVID-19 pandemic. Also, you can do screening at home. It looks like this. I don't know if you guys can see it on your screen. But it's an app that I encourage all of you, especially those with elderly parents or any older family members, to download. It provides live updates. It gives you more information about what you should do at home. And it has a live screening tool that you can use within the app itself. So it's something that's very useful to have. The last local resource I want to talk about is immigration. And I think we might have a couple of questions, but just to touch upon immigration real quick, we are concerned that ICE might be doing raids at some point within the community. They have, over the last couple of weeks, had raids in parts of the country. So there's a Know Your Rights resources for ICE that we are distributing along with our partners, Asian Americans Advancing Justice. They have some really great information that you can put out there, that they've put out there. It's in different languages. And they're happy to, we're happy to provide that information. Again, if you have questions, please do call CARE Georgia. These are all the sort of local resources that are available in terms of local governments there and some businesses. Some private organizations are doing some really great work too, and we'll do more to share that information as well. That's not something that's part of this presentation, but there are Georgia local private groups that are doing some really great work to provide resources, whether it's food, housing assistance, utility assistance, unfortunately, funeral assistance. There are organizations that are doing that work. If you call CARE Georgia, we'll be happy to provide that. And we'd also put some information out in our FAQs as well about that. But that's it in terms of the information we have for local resources. If there are any other questions, I'm happy to answer them. I want to thank both our communications director, Salsan Salim, as well as the SPLC Action Fund and Isabel Otero for joining us and for the amazing information that they gave us. This presentation there's a lot of information that we have to provide, and we want to provide it for the community and want you to engage with us and ask us these questions. But if there's any time that you feel that we haven't done that, please do reach out to us. You have our contact information, you have our email, you have our Facebook pages. We're very accessible through that, so we'd be happy to address any of those issues.
Thank you all so much for having me. And thank you to all those who asked any questions and stayed engaged and gave us your time and attention.
Thank you all so much for coming and joining us, and the amount of people who are so excited about the information that you provided. We really do thank you, Brother Morteza and Sister Isabel. Thank you so much for being with us. And we do want to go ahead and say that if you have any questions, we will give a few minutes for people to submit any last-minute questions. Please know that this is just it's just one event out of many to come, inshallah. So if you want to reach out to us, make sure you contact me. I would love to engage with you at ssalim@care.com. If you have any questions about your specific case, you can also contact Morteza at mkhwaja@care.com. And be sure to subscribe to this YouTube channel so that you get to see the future webinars that occur. And join the Facebook group. So we do have a Facebook group called the COVID 20 Initiative with all of the different webinars and events that are happening. And hopefully, inshallah, we'll start a resource section so that you'll be able to access the resources that were shared during this, this webinar and the future webinars to come. So if there aren't any other questions,
there's one last thing that I wanted to end with, just in terms of, because while there are a lot of resources available both on a federal level and a state level, I do want to again emphasize that we know that this is not enough, and we need your voices to continue to lobby to your representatives and to your local organizations to say that we need to do more. There are people that are losing their lives, loved ones are passing away. We're in the middle of the largest pandemic and global health crisis of our times, and our government is not doing enough. Specifically, the Georgia government, but our national government isn't doing enough either. On a local level, Atlanta has the largest level of income inequality in the country for any city. That's including New York, that's including San Francisco. Atlanta has the highest level of income inequality. And what comes with that is that lack of social services for the most marginalized people. Because we've seen, again, we go back to the numbers, Georgia's 49th in healthcare access. So our most marginalized communities are not getting the services they deserve. Part of that, something you can do, a proactive step, fill out your censuses. It was National Census Day a couple days ago, but you can still fill out your census. You can do it online. That's a way to ensure that you are counted, that people see you as a community, that people recognize you and your families and your larger community as well.
And you can go to my2020census.gov. You don't have to wait until the census sends you a letter with a code or any other information. You can go online right now. It'll take you maybe 3 minutes. You can do it over your phone. You just need your address and make sure that everyone in your household is counted, because it's absolutely critical that all federal resources and local resources are given correctly, right, for the amount of people in our communities. And our state has definitely grown. And I just want to echo that we need to keep calling and talking to our congressional representatives and our local representatives and our governor. We are in a red state, but they have to hear from everybody, right? And they have to hear from those folks in communities that they don't necessarily think of whenever they're deciding things for themselves. And so it's very important that all of us, no matter where you are in Georgia or across the South, call your representatives, make sure they understand what you and your family needs in order to get through this crisis and what changes you're expecting from them.
Thank you so much for that, Isabel. And we will have further webinars and webisodes. We'd love to have Isabel back as a host on some of those. And one of them is going to be specifically on our healthcare system and access to healthcare. Again, access to healthcare in Georgia is a huge problem. And because of that, we have some of the largest incidences of things like hypertension, strokes, diabetes, and a lot of other major afflictions. And it's because our healthcare system doesn't work for the people. And that's not just a state problem, that is a national problem, but it's exacerbated in a state like Georgia. So we look forward to that. That's going to be coming up, as well as a host of other webinars. And that's it for me. So assalamu alaikum, everyone. I'm going to kick it back off to Sausan, who can end it on a more positive note, hopefully. But thank you all for joining us. We appreciate it, and we're looking forward to continuing this conversation in the future, inshallah.
Thank you.
So once again, thank you so much, Mortaza and Isabel, for your time. And thank you all for joining us and being such great, engaged viewers. So inshallah, I will end with a dua. Oh Allah, grant me health with faith, faith with good conduct, success followed by further success, mercy and healing, and your forgiveness and your satisfaction. So Amin, thank you all so much for joining us once again. We will see you tomorrow at 8:30 p.m. for the Mind Your Health webinar. Assalamu alaikum.